I'm Dr. Sophia Yen, CEO and co-founder of Pandia Health. My mom said, always claim your titles. So all of you with PhDs and MBAs and JDs and everything out there, claim your titles. So Dr. Lenka, you may have to correct me and tell me you're Dr. Lenka, which may be the case. We're going to cover periods optional, also known as skip periods or menstrual regulation. We'll do a quick contraceptive update, emergency contraception, 4 types if you didn't know, and then IUDs are the latest and the greatest. And because Pandia Health, we're the only women-founded, women-led company in this space, we will always tell you what's best for your health, even if it's not best for my bottom line, because we care about you and your health over our bottom line. So we're going to start off with, is menstruation obsolete?
I think you muted yourself accidentally.
Yeah, there we go. Sorry, I have some technical difficulties with my computer and it likes to mute me. So as I was saying, here, Dr. Coutinho wrote in, I believe, scroll down, 1999, that periods are optional. And I didn't realize that until when I was trying to get pregnant. I realized that the only reason that we build up that lining every single month is to wait for an embryo. And if an embryo doesn't happen, then we bleed. And on average, in industrialized nations, we start our periods at age 12. And on average in the United States, we don't have our first child until 26. So that's 14 years of building up that lining, waiting for an embryo, no embryo, oh, bleed, build and bleed, build and bleed, build and bleed. And every time you build that lining, you risk endometrial cancer. Every time you pop out that egg and heal, you risk ovarian cancer. So if we're not trying to get pregnant from 12 to 26 or 12 to 35, for those of us who had more education or took a while to find somebody, then that's 20 years of incessant menstruation. And then on the backside, it's another 10 years after we pop out however many children that we decide to have. So if you don't need a period, which is building up the endometrium and sloughing, unless you're trying to get pregnant. And the only reason that those with uteri have periods is because they didn't get pregnant. And thinking about back in my day, I was a pre-med at MIT in the middle of a biochem final, and all of a sudden, bam, came my period. And I was like, do I run to the bathroom or do I finish my final? And being a pre-med, I finished my final. However, I looked to my left, I looked to my right, the men around me are just like, do. Why should I be at a disadvantage at every exam to have random blood fall upon me when these men are just cruising through life? Can't I attain that same peace of not having blood fall upon me? So if you're currently on the birth control pill patch ring, it's easy to skip your periods. You just skip that week off. And the only reason that these methods have 3 weeks of hormone and then 1 week without hormone is because one of the 3 founders of the birth control pill was a devout Catholic. His name was Dr. John Rock. And the other 2 founders were PhDs. And they said, why are you making women bleed every month? It could be every 3 months. It could be every 6 months. It could be never. But Dr. John Rock wanted to get the birth control pill through the Catholic Church. And he thought if he made the periods regular, the Catholic Church would approve of it, because in the Catholic Church it's fine to...
I think you just muted yourself again. I'm sorry, you are muted.
There we go.
Oh.
Okay. Sorry about that. Yes, I don't know why my computer keeps doing that. It's sabotaging me. I think it might be the conservatives who don't want me to give this talk. Okay, hopefully I will keep a watch on that. So bottom line is, since the inception of the pill, which is the front runner of the patch in the ring, we've had this 1 week of forced bleed because Dr. Rock was trying to get it through the Catholic Church. And he almost got it through the Catholic Church. It went through the nurses, they approved it. It went through the priests, very hard to do, they approved it. But it got to the Pope figured it out and vetoed it. But because of Dr. Rock, he fought out his other 2 co-founders and won. Every woman has bled every single month on these methods, thanks to Dr. Rock. And a great article to read, I love Malcolm Gladwell, is John Rock's Error, if you have access to the New Yorker or the Annals of Medicine. So just to educate. If you study Dr. Beverly Strassman, as discussed in Malcolm Gladwell's article, she went to study the Dogon tribe of Mali in Africa in today's world. And the women there were banished to the menstruation hut every single time that they had a period. They start their periods at 16. They give birth 8 to 9 times in their lives. They breastfeed for 18 months exclusively. How many periods do you have when you're pregnant or incessantly breastfeeding? None. So when we talk about the natural state of a woman or somebody with a uterus, it's actually, unfortunately, incessantly pregnant or breastfeeding, which is not as many periods as right now we're incessantly menstruating. So the natural state is 100 periods in your lifetime, but we are having 350 to 400 periods in our lifetime. So 3.5 to 4 times the amount of menstruation that we need. And so this incessant menstruation is actually new, something that we've come up with because we're delaying our fertility and not having as many children, which I think is a good thing, but is resulting in far more menstruation than necessary. So this is just my graphical representation. In the United States, under the white is the number of periods we have, and under green is the amount of periods that we should have or is natural if we were out in nature. Other reasons for turning off periods is quality of life, environmental. Women use 10,000 to 13,000 menstrual products in their life. And if we could cut that down to 1/3, we would save a lot of landfill and a lot of money. And then the other statistic that people don't realize.
I think you're muted. I think you're.
Sorry, I was struggling to figure out how to get to the unmute. My computer is muting me. Sorry about the technical difficulties. As I was saying, the #1 cause of missed school and work in a woman under the age of 25 is her periods. And so some of us don't have problems with our periods, but some women, that time of month is just horrible. And whenever I give a talk to a room of 30 women, even all CEOs who should have good insurance and good health care, 3 of them will come up afterwards and go, yeah, when I get my period, I have to just lay down in a corner in a fetal position and cry. Or how do I, tell my colleagues, do I tell my colleagues that I'm on my period? And if you have insurance, you should be able to see a medical provider and it shouldn't be that bad. We have the ability to turn down the amount of blood flow. We have the ability to make the pain less. So please, if any of you are suffering or missing work or school, see a medical provider and discuss that. That is not natural. Even if it runs in your family, doesn't mean you have to suffer. And then also what's interesting is we as physicians check women for anemia, but first they have to lose a whole bunch of iron before they get to anemia. Once they get to anemia, then we check their iron. But there are actually a ton of people that are iron deficient and not yet anemic. And so women who are being bloodlet, I like to think of slice and blood coming out 1 week out of 4, could be chronically iron deficient. And they've shown that in children who are iron deficient and not anemic, if you give them back their iron, their IQ and their math scores go back up. And so that may explain why women do slightly poorer in math in addition to societal stereotypes. And then just so people understand, if you use the birth control pill patch ring to skip your periods, then the lining isn't building up. It's just, and then you decide how often you want to bleed. It could be every 3 months, every 6 months, or never. And just to share TMI Tuesday, I haven't had a period in 9 years, as long as I remember to take my medicine. If I forget to take my medicine, then I end up having a period. So it is amazing and delightful not to have to bleed. And so it's a difficult concept for people to understand, but I'm sure all the sisters and Anita Borg people can understand that if you're not on medication, you should have a period every single month, or the physician or provider needs to figure out why. Do you have a thyroid problem? Are you not eating enough? Are you exercising too much? Do you have a tumor in your head? You want to skip your periods, then we have medications and technology to do that. And I would recommend the IUD with hormone, the implant. You could also do the shot. I don't recommend that because it's not good for your bone density, and it also gives you the munchies. And then there's the ring, the patch, the pill. all of these methods can be used to lighten your periods. And if you're on the ring, the patch, the pill, we can absolutely eliminate your periods. And the pill gives us more options because there's 7 different progesterones in that. Okay. And next, we're going to totally shift channels to the latest and greatest in birth control. So we want to make sure people know about emergency contraception. When to use emergency contraception: if you had heterosexual relations and the condom broke during sex 4 days ago, if you forgot to take 3 days of your medication in a row and it wasn't the week you're supposed to be off, and you haven't had 3 weeks of active pills before then you would be unprotected. If you didn't use anything during sex, if your NuvaRing fell out for 3 days and you didn't replace it, or if you're late for your Depo-Provera shot, or if unfortunately there's some form of sexual assault. These are all reasons to use emergency contraception. And the emphasis, you'll notice 4 days, 4 days, 4 days, because you can actually use any form of emergency contraception for up to 5 days after your contraceptive accident. However, we would suggest you take it as soon as possible. So the example I give, if the condom pops at 3 a.m., I want the medicine in the young woman's mouth at 3:10. I don't want any cuddling, snuggling, huddling, waiting till the morning after, waiting till 5 days after, because if at any point the woman ovulates, then emergency contraception pretty much won't work. So the #1 form of emergency contraception is the copper IUD. And most lay people don't know about this, and most physicians, many physicians don't know about this. So if you go into an emergency room and you need emergency contraception, you want the best possible emergency contraception, ask for the copper IUD. It works again within the 5 days, and this is the only method that has the same efficacy throughout the 5 days, and it's because of its mechanism of action. The copper IUDs kill sperm and kill ova wherever they go, and so you can imagine if it can kill a 1-cell organism, it can certainly kill a 2-cell to 8-cell organism as it goes through. The negative of it is it's $500 to $800, but under the Affordable Care Act in the United States, it's free, no copay, no deductible with most insurance unless you have a religious waiver by your employer. Usually I don't recommend the copper IUD because the major side effects of the copper IUD is more blood, more pain with your periods, but for emergency contraception, it is the best possible method. I'm getting the hang of this muting. Okay, and then the second one is ELA, or olaprystyl acetate. If you see here what you're seeing, in blue is the percentage of pregnancies if you use Plan B or its generics, levonorgestrel. In red is the percentage of pregnancies on ELA. And so ELA is only available by prescription. But again, under the Affordable Care Act, no copay, no deductible if your physician or provider writes the prescription. And if it were me or my daughter, I would absolutely choose ELA over the over-the-counter because I wouldn't want any risk of pregnancy. So ELA works better at every time point. ELA also works better for people who have a body mass index of 26 or greater. So I think I'm going to hit on a later slide. But again, for those who have a body mass index of 26 or greater, Plan B and its generics are as effective as water. So if you need emergency contraception, do not use Plan B and its generics if your BMI is 26 or greater. Or as an aside, you could double up and that should work, but ELA would be my choice. So emergency contraception, we want to make sure you know that it's a backup method and it is not Plan A, it is Plan B. You should use effective methods that's 99.9999% effective if you use it regularly, whereas emergency contraception has efficacy of 75 to 95% depending where a woman is in her cycle. If her egg is popping out, much lower efficacy. If her egg's coming out in 5 days, then the way most emergency contraception works is it tells your body, hey, she's pregnant. And then your body's like, oh, why would I release an egg? So that is the main mechanism of emergency contraception, is blocking ovulation, blocking your body from releasing that. Most common side effects are nausea, 23%, vomiting, 6%, and irregular bleeding. It can be taken up for up to 5 days. And this is just a chart that I like to say, every hour you wait taking the medication, you double your chance of getting pregnant. So take it as soon as possible. and it does not protect against sexually transmitted infections. If you have a positive pregnancy test, don't take it. It doesn't do anything. It does not cause an abortion termination. It does not cause teratogenicity in arm or leg or mutation. It just won't affect a pregnancy. And as I mentioned before, emergency contraception, if your body mass index is 26 or greater, Plan B and its generics are as good as placebo. And if your BMI is 35 or greater, then the copper IUD is your only chance. How does it work? As I mentioned, it blocks ovulation, it blocks the sperm from migrating. And then the key for those of us having heterosexual sex, make sure your male partner knows about emergency contraception. Because if I would be like 4 out of 5 chance she won't get pregnant. Why should I tell her that the condom popped? But if I knew about emergency contraception, I'd be like, oh my goodness, where's that emergency contraception? Here, I have some Plan B. And in my ideal world, the woman would reply, the person with the uterus, I have some Ella, bum, bum, bum. And so you would be well protected. And emergency contraception should be thought of as a fire extinguisher. So at Pandia Health, the only practicing reproductive health physician founded company, we offer everybody a prescription for emergency contraception, and we fill it whenever we offer anybody birth control, because we know that you might have a condom pop. We know that you might miss a couple of days of your birth control. And so it should be a fire extinguisher sitting in the corner in case of emergency, rather than you running to a pharmacy. Do you have the medication? Is it covered by my insurance? Do I have money? And then you are in trouble. So this is the analogy. Have emergency contraception when you need it so you can save your burning house down. Otherwise, your house burns down. And let's see, long-acting reversible contraceptives. Just know that the best contraceptives out there are the intrauterine device with hormone, but there's also the copper, the implant, the shot. I'm not a fan of the shot because it gives you the munchies and is not good for your bone density, but better something than nothing. And so the new paradigm in contraception is start with the best and work your way down. And so if you need to tell the provider why you don't want the IUD, why you don't want the implant, why you don't want the shot, and then we'll proceed to provide you the ring, the patch, the pill. But if you're not ready for these methods, then for those of you in the United States, Pandia Health is here for you to make sure you never run out of birth control on our watch. And IUDs are fine for somebody who's never had a baby. IUDs do not increase your risk of pelvic inflammatory disease. And for that fertility question, IUDs and other forms of hormonal birth control do not affect your future fertility. So we'll just stop here to pause and talk about birth control and fertility. What it is that 10% of women have this condition called polycystic ovarian syndrome. And those women, when they try to get pregnant, will have a difficult time because their eggs don't pop out every month. And if your eggs don't pop out, then you can't get pregnant. However, if we put all women on birth control, then 10% of women, when they come off of birth control, will have a hard time getting pregnant. But it's not because of the birth control, it's because they had polycystic ovarian syndrome and either it wasn't diagnosed at the time or they developed it. So it's not the birth control causing infertility. Certainly birth control causes infertility while you're taking it because of birth control. But off of birth control, your fertility should resume. And the example I like to give with the IUD is if you're stuck in the middle of Africa and you meet the most amazing man ever and you're like, I need to reproduce with him now, but I got an IUD, you could just reach up, yank it out, and bam, within the next 2 weeks to a month, you could create a baby. So very reversible. The implant goes in your arm. You could just, alcohol it, iodine it up, do a little thing, pull it out, bam, pregnant within your next lining growing up. The pill, the same thing, out of your system within a week. The only one that stays in your system is the shot, and that's because it's a depot version, and so it can sit in your body for 3 months to 9 months. So if you can't wait 9 months, then don't use Depo-Provera because it may take 9 months to wash out of your system. So just want to reassure everyone, any hormonal birth control does not affect your future fertility. And then a great resource is bedsider.org. They have great information on birth control. And then there's a bunch of IUDs out there. We can talk about that if you're interested, but know that you don't need the lower one. The implant has some side effects of irregular bleeding. And I just spoke to someone that had bad acne, but each woman is different. And the new thing is Anovera is coming out, and it's a 1-year vaginal ring. So you see here on the bottom right, you just stick it in your vagina, leave it for a year, and then change it once a year. If you want to bleed, you take it out for 5 days, and you'll bleed during that time, and then put it back in on day 6. The problem is whether or not it's covered by insurance. I think it's $2,000, but I guess that's equivalent to the current ring, which is $150 a month. But again, if you have insurance in the United States, it should be covered under the Affordable Care Act. And that's it. So I'll let Lenka take over, and we can take questions.
Sure, I can, if you want, I can unmute. And
Great.
if anybody has a question, please raise your hand. You should see a hand by your hand icon on your side. If you cannot raise hand, you can also write your question in the Q&A part.
Or if Lenka, you have any questions, or I'm happy to just ramble about birth control. So I'm glad I was able to finish within 30 minutes because I can go on talking forever. Ooh, somebody says, I have PCOS and I'm a little hairy. So yes, if you Google Pandia Health blog, PCOS, we have a great blog on it, and there's a talk that I did for Stanford on basic clinical, not even clinical, but dietary changes you can make. But if you have polycystic ovarian syndrome, which we can discuss here and now, what it is that oftentimes you have a high insulin level. 90% of women that have PCOS are overweight or obese, but some people just have a defect in their insulin sensitization. And so instead of popping out an egg every month, it takes your female hormones and it converts it to male hormones. So people with PCOS have higher levels of testosterone. We all have testosterone and estrogen in us as those with uteruses, but during puberty and those with PCOS have more testosterone. And so that high level testosterone blocks the eggs from popping out. What the birth control pill does is it blocks that natural creation and conversion into this male hormone. It also increases your level of the sex hormone binding globulin. So that binds the testosterone and keeps it from running around in a muck. So the birth control pill, patch, or ring would absolutely help somebody with polycystic ovarian syndrome. So great question. Any other thoughts, questions? And then another medication that's good for polycystic ovarian syndrome is metformin. So metformin is usually used for treating diabetes, but it sensitizes you to insulin. And so you have a lower insulin level, which then blocks that conversion of estrogen into testosterone, causing the acne and hairiness. Some people are hairy because they're, quote, Mediterranean and it runs in the family, but part of the running in the family may also be polycystic ovarian syndrome. A great follow-up question is, how long will it take me to get less hairy or less acne? Unfortunately, as you know, hair grows slowly, but if you were to shave, pluck, or otherwise remove the hair, then as soon as you start the birth control, I would think within a day or two or a week, no new growth would be happening. And then acne, you know, sometimes has its course. It has to run its course. I love acne. That's another thing I love is birth control and acne and turning off periods. That may, you know, there may be some zits on its way, but as soon as you start the medication, again, within 3 to 5 days, it should be taking effect and there will be less future acne. The other thing for women to 8 different types of progesterone. So I would suggest that you ask for norgestimate is good for not acne. Desogestrel is the one that I like because it's less acne and makes you able to skip your periods. And then drospirenone is the strongest one. However, for that one, you have to drink at least 8 glasses of water a day because it has a diuretic effect. And for those of us who don't drink good water, or if you have a teenager or somebody who hates going to the bathroom during the day and has headaches, drospirenone is not good because they won't drink water, then they will have headaches all the time. So those are the top ones I would recommend for acne. If you're on one with levonorgestrel or norethindrone, those aren't as good for acne, though technically any of these methods that turn off your natural hormone going out are good for acne. So that applies just for acne in general, and that also applies for polycystic ovarian syndrome. And for those of you who are not interested in birth control, the benefits of birth control, not for birth control, is simply if you skip your periods and you maintain a stable hormone, that's better for depression, for seizures, for diabetes, just for life. If you have a teenager with a lot of attitude and her hormones are up and down, it would be nice to smooth it out. If that teenager also has a ton of acne, fix the acne a little bit. For some people, for me, when I was growing up, I would only have one zit a month, either the North Star or the chin, and it would only happen with my periods. If we eliminate periods, no acne. So many benefits to it. The one risk is that it does increase your risk of estrogen, so it may slightly increase your risk of breast cancer. However, the decreased risk in endometrial, ovarian, and colorectal cancer outweighs the risk of the breast cancer. So for 45-year-olds, birth control options are limited. So I'm 49, almost 49, and going to be 50 soon. And a lot of women are like, my husband has a vasectomy, I don't need birth control. But if you're bleeding every single month, or you're bleeding wackily as you enter perimenopause, menopause, let's turn the sucker off. And then every 6 months you can come off and check if menopause is hit. And if it's hit, then you're done. So if you're older, there are people that are hesitant to prescribe to you, but there is a 20 microgram birth control pill that you can use. And I spoke to my endocrinologist friend, and she said we can keep people on that until they're 50 years old. There's also a 10 microgram one, but I don't recommend that one because cost effective wise, it's crazy expensive. It's $150. But for the 45-year-olds and up, we switch them to a 20 microgram birth control pill. And again, I'm personally using the desogestrel one. There's Viorel and a pre, and whichever one's the 20 microgram one is the one that I would recommend for the 45 and up. Love answering birth control questions. Also, you can use the IUD. You could also use the implant. And in general, I just recommend everybody use condoms, because one thing I think we don't talk about is the grossness of having sperm leaking out of you for the next 24 hours. If in any heterosexual interaction, the male walked away with stuff dripping out of his body for 24 hours, he would dang well make sure you use a condom. So as we say in adolescent medicine, no glove, no love. And in Espanol, no globos, no fiesta. And then know that there are thinner condoms out there with better sensation. And so specifically, there's a great website I love called condomdepot.com, and it has, he said, gave it a B+. She gave it an A-. So in my teen clinic, we make sure we have the best condoms possible because I want the best compliance. And so is it Crown, Skinless Skin, and Kimono are the thinnest ones without greater breakage. So those are great condoms to use for better adherence, better compliance.
I have a question, which might be very light, but if you use birth control for years and years, and we know where we are born with certain amount of eggs, do we also postpone ovulation since we don't ovulate, right? If I don't have my menstruation, I do not ovulate. Therefore, do I prolong my fertility?
That is a very good question. Related? And many people have asked that question. And unfortunately, whether or not you use them, your body expires them. So yeah, a lot of people were hoping that if we turned off their eggs, they would have another 5-10 years on this side. But unfortunately, as I like to say, we were all supposed to like reproduce at 16 and die at 30. So any years beyond that is gravy. And so that's why we get cancer. That's why bad things happen beyond that age. So unfortunately, I don't know what the mechanism in signaling is. The body kills or reabsorbs those oocytes that we were born with. So, but in the future, anybody, who's doing science can look into what is that signal. for apoptosis, and we can tell the body, no, stop that. We want to use these for later, and then we don't have to do IVF and these other invasive methods. So someone was asking, what are the side effects of using birth control for PCOS? So the side effects of using birth control are the same as using birth. And what it is nausea, vomiting, well, vomiting with the nausea, but not that much, and irregular periods. Some people notice an increase in breast size of 1/2 cup, which a lot of people think is a bonus. The nausea can be easily avoided. If you go to YouTube, we're really proud that we've made a video with 150,000 hits with no promotion, which is first time on birth control. Here are some tips. And the #1 tip is don't start your birth control first thing in the morning on an empty stomach, because then you will get nausea. But if you take it right before you go to bed, I've only had 2 patients in my 10+ years of prescribing birth control wake up with nauseous dreams. And that just FYI, there were people who were very skinny, and so probably the hormone dose was stronger for them, and therefore they had the nausea, and so we had to drop them on the hormonal side effects. But nausea, and then you shouldn't have more acne, you should have less acne. So that's a side effect, is less acne. The irregular periods is only because the system takes over your period and forces you to have a period every 4 weeks if you want, or no period at all. Again, one of our tips for first time on birth control is start your birth control on the last day of your period. A lot of physicians will tell you to start on the first day because they want to make sure you're covered, but you're covered as long as you didn't go out too far on this end and the egg was getting ready to pop out. And so I like the uterus to be cleaned out, so that we put hormones on a clean, fresh palette, as opposed to one that's somewhere in its cycle and we don't know, and we throw hormones on it, and then you'll have irregular bleeding. So some women experience irregular bleeding when they start the pill because we've put it on a not clean palette, and the palette's like, oh, I want to bleed. Whereas if you did it on a clean palette, it's a much more beautiful thing. I haven't done the research on it, but to me, it makes scientific sense. And then there's always a risk of blood clots. So if you have some weird blood clotting disease in your family, there's an Aches mnemonic. And for those of you, Anita Borg, you're well educated, you understand these words, but sometimes these words are too big for lay people. A is abdominal pain, C is chest pain, H is headache, E is eyes, weird vision, and S is swelling, but only one leg. If 2 legs are swelling, it's something else. But if any of these things happen, it could be a blood clot in your abdomen, a blood clot in your chest, blood clot in your head, blood clot in your eyes, blood clot in your leg. So if you have any clotting disorder running in your family, look for protein C, protein S. I forget some other mutation that you have to look for, then definitely check in. And when you're on a plane, I advise women to take an ibuprofen or an aspirin before the plane and drink water and walk around to avoid blood clots. Only if it's beyond 3 to 5 hours, generally 5 hours. But anything less than that, don't worry about it. But again, Anita Borg, women are flying everywhere. So anything beyond 5 hours, take an ibuprofen or aspirin, drink water, walk around if you're on any method with estrogen, because you have an increased risk of blood clots. So thank you, Chris and Anka and other person, for your questions. Still have a little more time for more questions or other topics if you want to ask about acne, teenagers, HPV vaccine. I also know a lot about obesity. For PCOS, I would recommend that you use metformin and a birth control pill patch ring. One of those 3, not all 3 of the pill patch ring. Any other questions or throw out? Is metformin expensive? So a good reference is goodrx.com. They usually have the cheapest prices possible for those who are cash, and as well as, yeah, for those who are cash, because those who are insurance shouldn't have any issues. But metformin is generic, so I believe it's relatively expensive. So just go to GoodRx right now and Google metformin. And not Google, but put in the thing, metformin. And there's an extended release one, which will be more expensive. Don't go with that. Just go with the normal one if you're trying to save money. What other things? Life hacks. For those of you who aren't married yet, my life hack to you is that your partner is very, very important. And what I established with my partner was that as long as I do input on our babies, you do output. So as long as I was breastfeeding, he did all diapers. So I did not do any diapers for the first 3 months of my child's life, because as long as I'm doing input, you're doing output. And I think it's really important from the beginning of a child that you are splitting stuff 50-50. Otherwise, you're going to get the second shift, which is all the baby care and all of that. And you call me an evil significant other, but every time I had to get up, he had to get up, because I like to share pain. So that's my tip for making sure you maintain equality in your relationship. And I see there's one Q&A. Fibroids. I am not an OB-GYN. I am a pediatrician that did another 3 years to specialize in teenagers. And then because I'm an academic clinical associate professor, I specialized in sex and prevention of unplanned pregnancy, and now turning off periods and educating women about periods optional. Fibroids are generally something that occurs in older women outside of the adolescent years, so 30 years old and up. They run in families. They can absolutely affect your fertility. They can absolutely give you whack periods. The question is, which hormone, estrogen or progesterone, would cause them to grow bigger or more? Would being on a birth control pill, patch, or ring stabilize it and tell it not to grow? These are things that I would suggest you talk to your gynecologist about. And basically, it depends how big it is and then which approach. I think I recently read that progesterone only is best for endometriosis, which I would think may be similar for fibroid. So if your fibroid is small, you may want to go on a progesterone only method that may keep it small rather than estrogen progesterone, which may do something to it. And if it's big, you definitely want it removed. I've had 2 friends that recently had things the size of like this in their body, and they gained 10, 20 pounds, and the rest of their body was okay. But if you notice there's fat on other parts of your body, then it's not a fibroid. But if it's down here and it's dull, then it could be a fibroid. So definitely get that checked out and check the latest treatment on that. All right. If anybody ever has any questions about startup life, I started Pandia Health because I was giving a talk to a bunch of physicians. Why don't those women take their pesky birth control? And it was because they didn't have time to go to the pharmacy. I like to do hashtags. So hashtag better things to do than run to the pharmacy every single month. Hashtag Pandia Peace of Mind. Started Pandia Health so that we ship women their birth control, keep shipping it to them until they tell us to stop. And then when we ran ads for free birth control delivery, 60% of those women that would respond, and we just ran some ads in Arizona, 90% of the women in Arizona that respond to free birth control delivery don't have a prescription. I'm a doctor, I can write prescriptions, so we added on our telemedicine. So our telemedicine is asynchronous. You just fill out a questionnaire, the same questions I would ask you if you came into my clinic: blood clots, drugs, family history, you know, which ones have you tried? Which ones do you want to try? Do you want to skip your periods? Do you not want to skip your periods? And you pay $29 once a year to have access to our healthcare for 364 days about your birth control. Our physician looks at it. If it looks good, we write, and you're done for the year. Set it and forget it. Let Pandia worry so you don't have to. And we are the only women-founded, women-led company in this space. So we hope that you will educate others that they should check who are the CEOs and founders of the companies that are running the services that they use. And we hope that you will tell people about Pandia Health and about Periods Optional. So pandiahealth.com/periods optional talks about it, has my TEDx talk on the safety and science, which you've pretty much heard here today. It's at the bottom, and on the top is a video if you're on the pill or ring, how you can skip your periods. And we're always available on YouTube. And I know the Sisters video is going to be on YouTube. I love Anita Borg, and I'm going to go sign up for Sisters as soon as I get off this call. And we also set up a code, Sisters 2019 or 2019. If you enter that code, we'll donate to Sisters and Anita.org for every person that signs up and uses our free delivery services. And we'll also give you $5 off if you need a telemedicine visit in California or Florida. We can deliver to all 50 states, but we can only prescribe in California and Florida for now, but we're partnering with a group that we might be able to prescribe to 25 more states.
We still have 30 minutes. There's still room for questions.
Yes, if you have any questions, what other things? Obesity tip, eat your fruit, don't drink it. So there should be no juice in your house. The S diet is not a diet. When I say diet, I mean, what do you eat every day? Not, I'm going on this diet to lose crazy weight and then I'm going back the way I am. Because we could all lose down to 100 pounds if we did some crazy diet, but then we go back to where we were. So diet means something you do for the rest of your life. So the S diet is no sweets or seconds except for Saturday, Sunday, and special occasions. And even then I added only a single serving. So if you're gonna have cake and ice cream, you only can have half a serving of cake, half a serving of ice cream. And if it's Saturday, Sunday, or special occasion, you can't go crazy. You only get a single serving. And then just to express the passion that I have for reproductive health and making women's lives easier, I'm the only CEO I think you're gonna see with a condom bag, dun, 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 a uterus necklace, dun, 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 and a beaver ring. And probably only the CEO you're gonna see with one of those. Well, the beaver ring you might see, but in birth control. So again, for all the women out there, claim your titles, claim your credibility. And for me, it's the beaver ring. Whenever I or impress people, I bring the beaver ring, which is MIT, by the way, for those of you who don't know. And then the uterus necklace is just, it connects me with my customers. And I like to tell people, respect the womb. We all came from the womb. No one escapes the womb. So trust women with personal health decisions. And I hope that women will help lift women. And my other favorite quote is by Madeleine Albright. There's a special place in hell for women that don't help women. Here's a good question. Hardest thing about being a woman CEO, and what do you do to deal with it? I think that being a woman CEO, being a woman founder, when I pitch VC, which 97% are males and generally 50 and up or even 60 and up, they see what I see as benefits as negatives. They see an older woman, mother, doctor. And older, to me, more experience, better Rolodex. Woman understands the product and can come up with more products all the time. Doctor, domain expertise. And then lastly, mother, once you've had children and your youngest is at 5, you are back at full productivity plus. And you look at everyone without children and you're like, what are you doing with all your time? You have the evenings and weekends, all this time that has been sucked away by my children come back to you when your youngest goes off to school. So my youngest is now 10. So I am at crazy productivity. So these negatives that they see about me, I see as positives. But often I wonder, and I've been told by my African-American friend, I should just hire a Caucasian male to go pitch, make him CEO, and then 2 years later, have the agreement, he leaves and I'm CEO again. But I think that's messed up and I shouldn't have to go that way. And the good news is I believe with any VCs 50 and under, male-wise, they're more open-minded. And as long as you make your financial pitch, they should understand it. But still, I can always sell the administrative assistant when I check in on my product. Do you want to never have to worry about running the pharmacy again? Do you want to skip the trip? Do you want Pandia peace of mind? Hell yeah. And then when I pitch some men, the VC men, they're like, is that really a problem? How hard is it to run to the pharmacy every single month for 20, 40 years of your life? It's kind of hard. And can't you just get your assistant to go? My wife loves going to the pharmacy. Well, not everybody has the luxury or the time to run to the pharmacy. We calculate women spend 10 weeks of their lives going to the pharmacy, waiting for the medication. better things to do. So, and the hard part about being a woman CEO or just being a CEO and doing a startup is that it's like a roller coaster. And I hate roller coasters. You will hit your highest highs and your lowest lows within seconds. You get an email and you get a person that says, I want to invest in you. Yes. You get another email, we're giving your competitor an award from your alma mater for being best in show. And you're like, no, no, no. And it's hard sometimes to not go negative and to stay positive, but having an amazing team, a shout out to my team, Angela and Susanna and my CTO, Elliot, and PC, and all of our patient care advisors. We've built a passionate team that cares about improving women's lives, and I'm just thankful.
What was the breaking point or inspiration to found this startup, Pandia Health?
Yeah, so I started Pandia Health because I realized that women have better things to do than run to the pharmacy, and that I had personally suffered, I actually made up the term, never used before in medicine, pill anxiety, where you're in a pack of pills and you get to that last week. And if you don't get to the pharmacy, there will be a dire consequence. And I have suffered that personally for 20 years of my life. And in today's world, when everything comes in the mail, this should come in the mail too. This should automatically come in the mail. So I started it to make women's lives better so that no one has to have that stressful nagging in the background. And at Pandia Health, we're building the brand that women trust with their health, because we're the only practicing reproductive health doctor-founded company. We're the only women-founded, women-led company in this space.
Great.
Cool.
Any more questions? Anyone? We still have
last chance, free doctor advice.
Last 6 minutes of our webinar.
Make sure everybody gets the HPV vaccine. And if you are divorced or back in the saddle again, get the HPV vaccine. The only reason that women have cervical cancer, most of it, 99.999%, is HPV. But also know that the HPV only covers 9 out of 160 strains. So condoms, condoms, condoms. Random health tips. What's the deal with men and HPV? Men should also get the HPV vaccine. Men are the ones that give it to women in heterosexual relationships. Men, and they can actually get oral cancer too. I believe somebody really famous, Michael Douglas, got oral cancer because he does oral sex. And so he got HPV that way. HPV can also happen to women who have sex with women, because you can get warts on your finger and then you're doing this and then you got warts from the vagina to this or from this to the vagina. So HPV is a great vaccine. If you get it, I believe before 14, for those of you who have young people, you only need 2 shots, 1 shot 6 months apart. If you get it after 14 or 15, I forget the exact cutoff, it's 3 shots. And insurance will cover it up to age 26, but once you're beyond 26, they assume that you've been exposed to enough HPV and there's some cross-reactivity that is not cost-effective for them to pay for you. How do you talk your partner into getting the HPV vaccine? I assume vaccine and not vacation. The HPV vaccine, I always say blame Dr. Yen. Say you saw a talk by Dr. Yen and she freaked the hell out of you about HPV, and that maybe, you know, even though you're in a monogamous relationship and you're married and whatnot, if either of you have had partners before and if either of you have not used a condom with that person, then they could have given you HPV, and at any time you can give them HPV. So you can blame you or your previous partner as a potential place of harboring HPV. And then the one that always works for people is people won't do stuff for themselves, but they'll do it for their future babies. My beautiful babies. And if you're going to make a baby, you want to make the perfect baby. So if you have HPV in your vagina because your partner brought it in from his previous partners, or you brought it in from your previous partners, if the baby goes through that birth canal, it will get covered with HPV. And then the baby will have HPV in its trachea, and then it cannot breathe and it cannot speak. And it will have to have lasers to get rid of the HPV, because if you're born with it, your body doesn't kill it. Normally our body would kill HPV, but babies being exposed to it, it's like, oh, it's my friend, and you let it grow, and then you suffocate and you can't breathe. And so then your future baby may have to get a tracheostomy if it's bad enough to breathe and speak. So if you want a perfect baby, you want it prevented from HPV. So one appeal on, I could be giving it to you from my previous partners, or you could be bringing it to me or whatever, get the HPV. Or future baby, you want it as perfect as possible, don't give it HPV. And then the other crazy part is the cross reactivity. My, well, a family member, because my family member might chew me out, used to have warts. And when that family member got the HPV shot, all the warts went away on the fingers and on the knees. So that's a side benefit. So that was some fun questions about HPV. So I think ready to wrap up with Lenka, but please like us on all of our social media, on Twitter, on Instagram, on Facebook, on YouTube. Tell all your friends about us. And I'm Teen MD on Twitter. My stuff is a little more radical and political, but Pandia Health is awesome and all about making women's lives better. And thank you so much for inviting me to speak, and happy to come back and speak again if anybody wants.